Now at 11, less than 1% of Americans have had the COVID-19 vaccine so far, and the incoming CDC director predicts we could reach 500,000 deaths by just mid-February. Thank you for staying up with us. I'm Channing Frampton. Ava Van Valen is off tonight. With those numbers in mind, people living with disabilities are making the COVID-19 vaccine a priority. Tonight, advocates are pushing to more disabled Floridians in the first round of vaccinations. ABC 27's Christian Thomas spoke with people who say it could mean the difference between life and death.
I'm scared to death.
Amanda Baker says without the COVID-19 vaccine, she feels helpless. She's under 65 and doesn't qualify for the vaccine as it stands in Florida right now. Her daily life requiring help from caregivers, sometimes several in just 1 week.
I have no choice that come in and out. And they have other jobs which put them in contact with other people.
Advocates with Disability Rights Florida say there are thousands just like Baker in Florida, which is why they sent a letter to the governor urging him to consider them as part of the most vulnerable populations despite age.
It's really difficult for them to do things like social distancing. If you need someone to assist you with bathing or with feeding or getting dressed, you can't stay 6 feet away from that individual.
If you're living in a residential facility and are 65 and up with disabilities, another issue is distribution.
I like to see it happen faster and quicker, but it's a big need and evidently some challenges in receiving the distributions that are needed.
Baker says with many people in the disabled community suffering from underlying health conditions, if you get sick, it could be serious.
Our lives depend on the people that come in to help us. And, you're putting our lives at risk and their lives at risk by not giving us access to the vaccine.
Which is why they're hoping change comes soon. In Tallahassee, Christian Thomas, ABC 27.
Both agencies have been in contact with the Florida Department of Health and say they're working out plans for distribution once people do qualify. Right now, they hope the governor would consider adding them to early rounds of vaccinations.